Have you ever stopped to think about how a drug that essentially just opens a microscopic doorway for a single ion, potassium, can literally cure a patient's crushing chest pain? Or how it can rescue someone from severe refractory hypertension? It's kind of wild, right? How exactly does moving potassium out of a cell lead to such massive, life-saving clinical outcomes? Well, welcome to today's Explainer, where we're going to unravel that exact clinical paradox. We are diving deep into the pharmacotherapy of potassium channel openers.
Here's our quick agenda for this explainer. We'll start with the core concept and physiology, then cover the mechanism of action, introduce the big three drugs, take a closer look at the Nicorandil profile, jump over to minoxidil and diaxazide, and finish up with some high-yield exam pearls and a mnemonic.
All right, kicking things off with Section 1, Core Concept and Physiology.
Let's dive right in by defining the actual cellular target at the heart of our topic today, ATP-sensitive potassium channels, or KATP channels. These are found all over the place in different cell types. Now, normally, when a cell has plenty of energy, meaning high ATP, these channels are blocked tight. But the second ATP drops, those channels open up. So here's a quick question for you. Why does the movement of potassium matter so much for the resting membrane potential of smooth muscle? Well, potassium is highly concentrated inside the cell. When you open that channel, potassium naturally rushes out, and it takes its positive charge right along with it.
Moving right along to Section 2, Mechanism of Action. Let's walk through exactly how this builds into an actual functional pharmacological mechanism. Step 1, our drug opens up those ATP-sensitive potassium channels. Step 2, we get potassium efflux, literally potassium leaving the cell. Step 3, because all that positive charge is bailing out, the inside of the cell becomes even more negative. We call this membrane hyperpolarization. And here is the absolutely crucial link. When that smooth muscle membrane hyperpolarizes, voltage-gated calcium channels snap completely shut. Reduced intracellular calcium means the muscle simply cannot contract. The ultimate result? Vascular smooth muscle relaxation and widespread vasodilation. When you look at the macro-level pathways, potassium channels sit right alongside the other major relaxation and contraction mechanisms. They act as an incredibly powerful brake on smooth muscle contraction, directly fighting back against excitatory agonists that are trying to pull calcium into the cell.
Which brings us to Section 3, the big three drugs. So, zooming out to the systemic effects, how do we actually exploit this pathway in our patients? Briefly, I want to introduce you to our clinical heavy hitters. We've got Nicorandil, minoxidil, and diaxazide. All three of these share that fundamental mechanism of opening potassium channels, but as we'll see in a second, their specific tissue affinities give them wildly different clinical applications. Let's zoom in on the first one in Section 4, the Nicorandil profile.
Nicorandil is a massive exam target, mostly because it essentially packs two entirely different drugs into one single molecule. On one hand, it's a KATP channel activator, which, as we know, hyperpolarizes the cell and leads to arterial dilation. This drops the systemic vascular resistance, which is your afterload. But on the other hand, it has this nitrate-like effect. It acts as a nitric oxide donor. This NO release powerfully dilates the venous system, reducing the blood returning to the heart, which is your preload. So you're literally dropping both preload and afterload at the exact same time, all while increasing coronary blood flow.
Because of this, Nicorandil is often used as a rescue drug. We bring it out for patients dealing with stable or unstable angina who are still symptomatic even after we've optimized their other standard medications. But because it's such a potent vasodilator with those nitrate actions, you absolutely have to warn your patients about the side effects. That sudden vasodilation very commonly causes throbbing headaches, flushing, and dizziness.
Now, there's also this incredibly cool cardioprotective concept tied to this class called ischemic preconditioning. This is basically the heart's improved ability to withstand ischemia after experiencing previous, smaller ischemic episodes. It's like the heart is building up a tolerance. This whole process is heavily mediated by adenosine, which accumulates as ATP drops and ultimately opens those same potassium channels to protect the heart muscle. Drugs like Nicorandil are thought to tap directly into this cardioprotective pathway through mitochondrial KATP channels.
All right, on to Section 5, Minoxidil and diazoxide.
Transitioning to our remaining two KATP openers, let's start with a drug that is absolutely notorious for its side effects, making it a huge favorite for examiners. Meet minoxidil. This is a remarkably potent, long-acting arteriolar vasodilator. Clinically speaking, we reserve this as a drug of absolute last resort for severe or refractory hypertension that just won't respond to anything else.
But that potency, it comes with a cost. It causes such intense vasodilation that the body kind of panics. The sympathetic nervous system kicks into overdrive, causing profound reflex tachycardia, meaning you almost always have to co-prescribe a beta blocker. It also tells the kidneys to hold onto fluid, causing massive salt and water retention, which means you're also going to need a loop diuretic. But here is the real clinical anchor for your exams. You have to contrast its primary use in severe hypertension with its most famous side effect, hirsutism, or the uncontrolled regrowth of hair. It actually stimulates hair follicles to shift right into the active growth phase. In fact, this side effect is so prominent that minoxidil's active sulfate metabolite was repurposed and is now widely sold over the counter as a topical cream to treat baldness. You've probably seen it at the pharmacy.
Our third drug is diazoxide, and this one's a bit of a wild card. While it does relax smooth muscle and open KATP channels, just like the others, it has a very specific affinity. It strongly associates with the sulfonylurea receptor, or SUR, on the beta cells of the pancreas. Because of this, it plays a massive role in controlling insulin. When diazoxide opens the potassium channels in the pancreas, it hyperpolarizes the beta cell, which actually suppresses and completely inhibits insulin secretion. Because of this, its main modern use isn't actually for blood pressure at all, but for treating hyperinsulinism, like what you'd see with a pancreatic tumor, to prevent severe hypoglycemia. Let's wrap things up with Section 6, Exam Pearls and Mnemonic.
Time for a quick rapid-fire review to really synthesize and lock in this knowledge. Here's your first examiner question to test your active recall. Which dual-action potassium channel opener is used for refractory angina?
If you said nicorandil, you hit the nail on the head. Always remember that dual synergy. It's both a nitric oxide donor that reduces preload and a KATP opener that reduces afterload.
Okay, question 2. This is a classic, high-yield clinical vignette. Which drug causes hypertrichosis or hirsutism and is reserved for severe treatment-resistant hypertension?
That's minoxidil, for sure. It is an absolute board favorite because of that highly distinct hair growth side effect, along with the fact that you always need to pair it with loop diuretics and beta blockers.
I want you to take a mental snapshot of this summary table right now. Seriously, this is your mental map. Nicorandil is your angina drug with dual action. Minoxidil is your extreme hypertension drug with a hairy side effect. And diazoxide is your pancreas drug used to stop insulin secretion. If you can picture this table in your head, you have mastered the clinical applications of this class.
To make it even easier to recall on test day, just teach yourself the NIMI-D trick. It perfectly categorizes these drugs by their primary clinical anchors. Ni for nicorandil points to angina, Mi for minoxidil points to hypertension, and D for diazoxide points to dropping insulin. NIMI-D, angina, HTN, insulin. It's that simple.
Let's finish this explainer by circling back to the golden rule of the core physiological pathway. Remember? Potassium channel opening equals potassium efflux. This causes membrane hyperpolarization, which completely shuts out calcium, leading directly to smooth muscle relaxation. That is the core pharmacology behind this entire class. I highly encourage you to take a second and think about how brilliantly elegant this all is, how manipulating just one single ion channel pathway can result in such incredibly diverse, powerful, and life-saving clinical outcomes across the entire human body. It really makes you wonder, if we can master the heart, the blood vessels, and the pancreas with just one microscopic ion, what other cellular switches are out there, simply waiting for us to find the right key?